Hi, I'm Kendra Falth-Edwards, and I'm the Chief Marketing Officer for CarDon and Associates. And I want to welcome you today to the CarDon Resource Hub. This is where we take the most frequently asked questions in senior living and assemble a group of experts to come in and answer those questions. So let's go ahead and get started. Today, I want to welcome Ronni. She's with us today to help us, give us advice and navigate all of the information out there on Medicare and Medicare Advantage. And how do you navigate? How do you make those decisions? What types of things should you consider as you're thinking about what is best for you? So Ronni, why don't you introduce yourself and give us a little information about that?
Sure. I'm Ronni Highum. I own Senior Insurance Designers. I'm a Medicare Benefits Consultant, and I help my clients basically navigate through the weeds of Medicare, determining what works for them. Medicare is basically a federal health program for all U.S. adults 65 and older, and then also younger people who receive disability benefits. There are a couple of different options you have. Original Medicare, obviously, which everyone gets, and I can get further into that, but also the managed care plans, which are Part C, which is Medicare Advantage, and also Medicare supplement plans. And I'm happy to go into those as well.
That would be great. I think there's just a lot of misconceptions of what's out there, especially right now. You see all the commercials. There's so much information about the different plans, the different options. And so I'm curious how you help folks navigate what is best for them and what that coverage looks like, because I think people think Medicare's there for all of their different needs.
Right. For a lot of my clients, I sit down with them for a 20-30 minute session to start, or do it via phone. I have a simple thing called KISS. I say, keep it simple and safe. And I share that with my clients because I don't want to get people too involved in something that perhaps they don't even want to use or know about. Generally speaking, we talk about two separate types of plans, which is a Medicare Advantage plan, which is Part C, and we talk about a Medicare supplement plan, which could be Part G. Obviously, there's A, B, and C. A is your hospital, B is your doctor's visits, and then C is your Advantage, D is your drug plan, prescription drugs. Through managed care plans, which are your Medicare Advantage plans, there are different types. You have HMO, you have PPOs, you have HMO POS, you have preferred or private fee-for-service, and you also have SNP, which are special needs plans. So I sit down and listen to my client and ask them what works for them, what they're looking for in their Medicare, medical needs, et cetera, what kinds of things they have, what kind of drug coverage they're needing. And then we assess and work through a plan for them.
I think that's one of the most important things, is to look at it holistically. You have to look at where you are today. What types of challenges do you have if you have any chronic conditions or different types of things, where you are in that cycle. And I think it's just important to think about how you put the right things pieced together.
Correct.
To cover all of that you may be challenged with or thinking about, and really thinking about where you are today and thinking about possibilities of any future coverage you may have or need at the time.
That's correct. I just think it's important to educate yourself. And that is one thing I do with my clients, is I try to walk through ABCs of it and make it as simple as possible. And then obviously help them along the way each year.
Are there specific resources out there, Ronni, for people to go and to look, a questionnaire, any type of resource, or what should they Google or look for, and even a resource for an expert out there to help them navigate?
That's a really good question. I do point my clients only to look at Medicare.gov, Medicare.gov. Any other resources out there are not sanctioned through the government, and we want to make sure there's all kinds of information out there on TV programs, commercials, mailers, things like that. I think it's really important to not get inundated and in the weeds on that. I think it's important to have a benefits consultant. We are free. It's just we are paid by the insurance carrier that is provided by the government. It's something that they work in tandem together. There should be no charge for that. And also just sitting down and taking the opportunity to discuss what works best for you and your situation, and silence all the outside noise of all of the commercials, all of the phone numbers. I would not make any 800 phone number calls. I would contact your Social Security office if you have any questions, or go to medicare.gov or contact off of your Medicare card on the back of it, the number.
Oh, that's great. That's such good advice. I appreciate that, because I know there's a lot of information out there, and there's just a lot of challenging things, I think, for seniors to know that they're making the right decision. So I appreciate that. And it's free. I mean,
exactly. And the one thing I would say is just make sure that you don't open yourself up to changes that could affect your benefits for an entire year. I think once we get excited because we hear something on TV or in a commercial or something, and it's really important to be focused on and just listening to your consultant versus listening to all the other noise, because there are so many opportunities for you to have special benefits with each program. And I think that's important as well for each person.
Ronni, what's the timing of that? Because you do lock in for a year. So when is open enrollment? When should people really start thinking about any changes that they want to make or looking at their plan and their coverage?
Well, it's actually October 15th to December 7th. And you can start looking on, I would just reach out and contact someone. I do 20-minute appointments via phone or in person. And it's something that's pretty easy to sit down and discuss it. And not necessarily every year do you need to change. If you have a good plan in place, oftentimes you don't need to. So don't let the hype of everything make you think that you need to just automatically change every year, because the grass isn't always greener sometimes on the other side. So I definitely think it's something to sit down and take a 20-minute phone call to talk about it. Otherwise, if you're happy with your plan, I always recommend people not change unless they really feel that they need to.
Oh, that's great. And I appreciate the good advice and for you joining us today.
Thank you so much.